Malaysia reported 3,000 new COVID-19 cases today, its highest daily number ever.
Isytiharkan darurat bagi seluruh persekutuan.
The relaxation of several COVID-19 measures.
In 2020, the world population began to be shocked by the presence of a virus that cannot be seen grossly and has been confirmed by the World Health Organization (WHO), which was initially known as 2019 novel coronavirus 2019 nCoV. The virus that started in Wuhan, China, recorded the first case in Malaysia on January 23, 2020, where it is a non-citizen resident. Day by day, the number of cases in Malaysia and in the world continues to increase, making the world average of 4.51 million cases in the middle of 2020.
Through January 2020, Malaysia officially recorded their first case, which involved 2 individuals from the state of Sabah and 1 individual from the state of Selangor. Due to this matter, the Ministry of Health of Malaysia (MOH) have come out with various plans to prevent the spread of COVID-19 virus. The first action taken by the MOH was placing body temperature scanners at the Malaysia's international entry gates for the purpose of screening on every individual that entered Malaysia at that time. The second action was introducing an order called the Movement Control Order (MCO). The third one was launching the vaccination program organised by the MOH itself and the Special Committee for Ensuring Access to COVID-19 Vaccine Supply (JKJAV). And lastly, reminding the public to practice good personal hygiene concept and introducing the 3 Ws and the 3 Cs concept.
For the next part is organizing. Organizing is the process of determining the tasks to be done, who will do them, and how those tasks will be managed and coordinated. In order to cut off the spreading of COVID-19 in our country, our government was introduced the screening for symptoms at Malaysia International Entry Gate. This is to make sure that the people who were infected with the virus will not easily can enter to our country. For the next, which is the Movement Control Order (MCO). The decision was made under Prevention and Control of Infectious Disease Act 1988 and the Police Act 1967. Our Prime Minister Tan Sri Muhyiddin Yassin was said that this is progression of movement and mass assembly nationwide also would include all the religious, sport, social and cultural activities. All the work, shop and business premises must be closed except for supermarkets, public markets, grocery stores and also the stores that selling the basic necessities. For the next, other plan that our government do to prevent the increasing the transmission of the COVID-19 is announcing the National COVID-19 Immunization Program. According to Khairi Jamaluddin, the Malaysian Coordinating Minister of the National COVID-19 Immunization Program, there are currently 4 manufacturers for the COVID-19 vaccines approved in our country, which is Pfizer, BioNTech, AstraZeneca and Sinovac. To cut off the chain of COVID-19 in Malaysia, our government also giving the reminder to all the Malaysian citizens on how to avoid themselves from being infected by the virus. The Head of Health Department, Datuk Dr. Nur Hisham Abdullah, advised all the Malaysian citizens to practice good personal hygiene concept. The hygiene concept that had been told by Datuk Dr. Nur Hisham is the 3W concepts. 3W concepts are standing for wear, wash and warn. He also advised the public to wear masks when go out, also washing hands with soap and water for at least 20 seconds or sanitize hands with alcohol-based product and be aware of warning issued by the Majlis Kesihatan Negara (MKN).
What is decision making? In short, decision making is the process of choice making by identifying a decision, gathering information and assessing alternative solutions. Decision making can help us to build a solid goal and effectively achieve them. So, on 16 March 2020, the Prime Minister Tan Sri Muhyiddin Yassin had made a program type of decision by introducing an order called Movement Control Order (MCO) for 2 weeks, starting from 18 March until 31 March. And according to a website entitled Sunways Travel, there are 6 types of Movement Control Order that has been implemented by our Prime Minister at that time, namely the regular one, Movement Control Order, Conditioner, Recovery, Enhanced, Targeted Enhanced, and lastly, Administrative Enhanced Movement Control Order. Each of them were used depending on time and place. Next, beginning from 21 March 2020, in order to improve the effectiveness of the MCO, our government decided to place thermal scanners at both terminal buildings at KL International Airport before the check-in areas. Anyone who found with a body temperature above 38 degrees Celsius will not be allowed to go beyond the check-in areas. Based on the downtrend of new and active COVID-19 cases, it can be concluded that the movement control order has proven to be effective in order to curb the spread of COVID-19. Other than that, on 24 February 2021, our government had launched the National COVID-19 Immunization Program, and under it, Tan Sri Muhyiddin Yassin became the first Malaysian to be vaccinated. However, this decision involved risk, where there is no guarantee of the vaccine effectiveness as the virus keeps evolving, but at least it could lessen the risk. So everyone still has to be careful and strictly follow the order given by our Prime Minister. Last but not least, the Ministry of Health has taken steps by reminding the citizens to practice good personal hygiene concept by practicing the 3W, which stand for wash, wear and more. Datuk Dr. Nur Hisham Abdullah also remind everyone to avoid the 3C, which stand for crowded, confined and close. Briefly means everyone must avoid any crowded places and avoid talking in short distance. This action may seem like a small act, but the simple action of hand hygiene at key moments help us to protect ourselves against other infectious and contagious diseases.
In the next session, we will discuss the controlling strategy that has been implemented by the Ministry of Health Malaysia to overcome the COVID-19 outbreak. Controlling is any process that guides activity towards some predetermined goals. First, Datuk Dr. Nur Hisham said the ministry has so far screened more than 105,000 people in the country, 5,305 of whom tested positive. This represents an incidence rate of about 5%, which is fairly low in his opinion. This action by the government can reduce the risk of infectious disease to the public and also able to control COVID-19 cases that are becoming more prevalent in Malaysia. Other than that, Prime Minister Tan Sri Muhyiddin Yassin has introduced an order called the Movement Control Order, MCO. The effect of MCO in Malaysia has shown a positive effect and people's complaints exceed 95%. The numbers of new and active COVID-19 cases started showing evident downtrend from mid-April, thus indicating the effectiveness of movement control and its complaints. With daily COVID-19 diagnosis showing a downtrend, more business are allowed to resume operation, including manufacturers of packaging and printing materials, hardware stores, laundries, barbers and optometrists with conditions applied. Besides, Malaysia begins its COVID-19 immunization program in February 2021, starting with frontliner as a priority group. In a recent survey by the MOH, 85% of people in Malaysia are willing to get vaccinated against COVID-19. As of 26 November 2022, a total of 7,267,439 vaccine doses have been administered. Based on the latest data on October 5, 2022, 84.2% of people have received this vaccine injection. Finally, the MOH reminds the public of the importance of preventing the spread of COVID-19 through the enforcement of the Prevention and Control of Infectious Diseases Act 1988 and the orders under it. Based on the graph of the number of active cases, the number of COVID-19 cases is decreasing. It can help in ensuring that the transmission of this infection can be prevented and the risk of infection can be reduced.
In conclusion, all the decisions of the Ministry of Health are aimed at achieving the goal of 0% cases by breaking the chain of COVID-19. The COVID-19 outbreak has become a serious threat to our country as it will slow down GDP growth, the measure of our economic success. Especially when some companies has to close their doors due to the lack of customer, multiple sectors of the economy are closed, including tourism, manufacturing, construction, mining, and farming all have a major impact on our economy and even sport activity. In the end, we all agree that we can follow the government's prevention directive to fight COVID-19 disease because prevention is better than cure. We should be thankful that we were born in Malaysia. which has excellent healthcare facilities that have helped many without burdening them until Malaysia is recognized by the rest of the world.